Do I need my hormones checked? Is one of the most common questions that I hear every day in my practice from women, regardless of their age, 20s, 30s, up to their 50s and 60s, have certain symptoms that want to know if they need their hormones checked. And so we're going to go through a few situations that you may need your hormones checked and some that you really don't, because it's really not going to make a difference in the treatment plan. And again, in this video, we're assuming in these situations that pregnancy has been excluded. So number one is I get very moody before my period. It goes away after my period. I'll have a few good weeks during the month, and then it starts all over again. Do I need my hormones checked? The answer to this is actually no. You don't need your hormones checked for this. This is commonly what we call PMS, in severe cases PMDD. We know that it's hormonally related, but checking your hormones isn't going to make a difference in the treatment. So yes, it's hormonally related. No, you don't necessarily need your levels checked for this. I'm not having periods on my placebo or off week of my birth control pills. Do I need my hormones checked? The answer to this is no. You don't need your hormones checked. This can be very normal on your birth control pills. And secondly, we can't check your hormones when we're giving you hormones in the form of a pill. So in this situation, you do not need your hormones checked. What about I've been missing periods? I'll skip for months at a time. I can't seem to get the weight off. I'm getting extra hair, especially facial hair. Do I need to get my hormones checked? Yes, in this situation, you do need to get your hormones checked. You need to be checked for polycystic ovarian syndrome or other endocrine abnormalities, and then treatment options can go from there. I'm skipping periods, sometimes months at a time. My weight's really not an issue. I'm able to exercise and keep the weight off, but I'm getting extra facial hair. Do I need to get my hormones checked? Yes, the answer to this is also yes. You need to get your hormones checked. Again, you still need to be evaluated for PCOS because a small minority of people are not overweight that have PCOS. It still can happen, and you still need to be checked for other endocrinology processes. So you do need to get your hormones checked in this situation. I'm 30 years old. I haven't had a period for 8 months, but I'm not having any other problems. Do I need to get my hormones checked? Yes, the answer to this is you do need to get your hormones checked. It's not normal if you're not on any birth control or contraceptive, if you're not pregnant, to not have a period. So in this situation, you do need to get your hormones checked. I'm in my 50s and I haven't had a period for 8 months. I'm having some hot flashes and night sweats. Do I need to get my hormones checked? And that's going to be doctor dependent. So there's not necessarily anything wrong with you. That's a normal part of aging and a normal part of perimenopause and menopause. So you don't necessarily need your hormones checked in this situation. But your doctor may choose to draw some hormones, and they may choose to follow your hormone levels depending on what kind of treatment that you decide is best, that you and your doctor decide is best for you.